Hi, everybody. Happy Thursday. I hope everybody had a great day. I'm excited for this conversation today because it's one that I think is very important, is essential, especially tomorrow being the start of Black Maternal Health Week, right? So, this is one that we're going to talk about a little bit of everything. We're going to talk about what a doula is for those who might or might not know. We're going to speak a little bit about the disparities of Black maternal health. We're going to, it's going to be a long conversation, one that you don't want to miss. And of course, share it. Invite people to this combo. Invite your friends over here too. So to start the conversation off, I would like to invite my guests. First, I want to say thank you, Kay, for just coming in here and just informing the viewers on what a doula is and the importance that a doula have to the journey of a motherhood. So to kick it off, let's introduce who you are, what you do, and what gives you to become a doula.
Okay. Well, hello, everyone. I'm so happy to be here to be talking about how a doula can support and empower families. My name is Kay Clinton. I'm a full spectrum doula, so I support families from fertility, birth, postpartum, and even child infant loss. My business is Spiritual Garden Healing Doula Services, where our goal is just to empower families, support them, and advocate them and meet them where they are at on their journey. And so,
Wow.
yeah,
Wow.
so I got involved in becoming a doula
Mhm.
because of my own experience, having a lack of support. When I had my first child, I knew that I wanted to breastfeed. That wasn't common in my family. I knew I wanted to have a natural, unmedicated birth. That wasn't common. And so I felt alone in a lot of ways. And I told myself there has to be something that supports women. It doesn't matter what they want for their birth plan, but just having that support and that shoulder to lean on. And so it guided me here.
Yeah, I think that's important, honestly, especially in the motherhood journey, right? Having a support system, maybe not knowing whether you want to breastfeed or you do want to breastfeed. And how do you breastfeed? Those questions, I'm sure those questions came to mind during your journey. It's just so many, just the whole, just in my mind, just the whole motherhood journey from the initial to find out you're having a baby and so many questions that come as your stomach grows, right?
Mm-hmm.
The concerns that happens as you becoming a mom. So I think that it's good that just in hearing what you just mentioned, I could just imagine how you help other women not going through that, right? Going through the same journey that you've been through. So it's powerful and it's relatable to a lot of women. So I do also want to ask you another question because I know you just mentioned infertility. And I know some women do struggle, and I think most people assume doula, right? So they automatically think only motherhood, right? Only women that are pregnant. So how do you being a doula? How do you support women that are maybe have fertility issues, or currently maybe had a baby or struggling to have a baby? How do you help those women?
Okay, well, first off, that emotional support, right? That is tough on us. Like, we beat ourselves up all the time about things like that, even if it's out of like what we can do. Sometimes it's like we can't help what we're going through, and so
Mhm.
we as doulas, we're there to provide that emotional support. You have a friend in us who understands what you're going through, and someone you can confide in, and it not like we not judge you, but also that physical support. And so I've supported many families like through IVF and just fertility things. And I'll be honest, it is really hard on the family. And so just having someone there who understands the process, but also understands some holistic ways that can get your body going and moving and cleansing and getting prepared for a baby. Most fertility doulas have different remedies, especially depending on where they come from. So, if you are in the Haitian culture, then they have different Haitian, remedies that'll support you, or
Right.
African, and so it really just depends. But we definitely meet you where you are. We're making sure that we're advocating for you as well. Sometimes, especially through IVF, you're spending tons of money
Wow.
to try to get, trying to conceive. And sometimes the doctors aren't listening to what you have to say. And so we're there to advocate for you and build a plan, making sure that you're heard, but also making sure that you're educated on what can happen and what can't happen.
Wow, I think that's oh, wow, that's very important, right? Just the process of what you just stated as far as IVF and wanting to have a baby, and just the emotional tolls that go with IVF. Because I know when I was reading about IVF, sometimes you get a cycle and it doesn't always mean it's going to work, right?
Mm,
So that emotional toll, just as a woman, because culturally, most cultures associate womanhood with motherhood, right? So if you can't have a baby, some people might think something is wrong with you. And then
mhm.
you start to internalize that as a woman, assume that something wrong with you because you can have a baby, or because you need IVF to help you conceive a baby, right?
Right.
So I think that's important, just to be able to, have that emotional support, that psychological support, because it is a mental, psychological problem, just struggle, and just to understand that you're okay. It's just, you're going to be fine. It's just a process. You're going
Mhm.
to have your rainbow baby.
Right.
So I think that you really are helping women. And I know another thing that I want to touch on when you just mentioned cultural. And I because in me being in healthcare, cultural is important, right? Cultural
Mhm.
competency is important, because if you deal with patients from different backgrounds, they will have different beliefs, right?
Mhm.
So part of that is being able to um, allow the person to practice, right, their cultural belief through their pregnancy.
Yes.
Um, how do you have you found that to be maybe challenging, not for you working with the client, but maybe the providers? Maybe it's not you. Maybe sometimes it's the providers who have their own belief. Have you found that to be challenging? So to have the for advocate for your client, but also have the providers understand this is their beliefs.
Right. So it's not hard to advocate, but it is hard for some people to accept that
Yeah,
people do things differently.
yeah,
And so sometimes providers, they are not willing to budge, and that's unfair to the family. They should be
yeah,
looked at just as everyone else, but definitely traditions and cultural traditions should be respected in the birth space. It does not matter what that looks like, whether it's during fertility, birth, or even postpartum traditions, which is more common. They definitely should be respected. Like a tradition is, most people want to take their placenta and give it back to the earth, thanking Mother Earth, thank you for blessing me with this baby, and they'll have like a
mm,
burial ceremony. Um, but they might feel judged in the hospital
right,
asking for their placenta, and and they might get these dirty looks from the nurses or the
yeah,
midwife or OBGYN, but they're not having an understanding that this is something that's culturally
right,
respected for them. It's something that their family has done for generations, and they want to continue these traditions, but they sometimes don't know how to ask, or they feel uncomfortable, especially in just the Western
excuse me.
society. Bless you. Yeah, definitely in the Western society, in the hospitals, sometimes it feels so cold. They're moving really quickly, and a lot of times they don't feel comfortable asking for these things, and so we as doulas, we make sure that we know this beforehand. We build the birth plan before we even get to the hospital, so we know what those cultural traditions are, and we're making sure that we're advocating for you in that time of need. So if you just pushed out a baby and you don't have the strength to ask for it, then I'm gonna come and I'm gonna ask, hi, she wanted to
Oh,
keep that placenta, can you package it up for us please, and keep that going for the
oh,
family.
oh, wow. So you actually, the doula is actually in the birth. I mean, is the mother, if the mother wants the, well, I say mother and the parents, if the parents wants to doula in the birth, they
We're there.
can be in the birth.
Yes, we are there.
Oh,
We are there
wow.
again. That's that physical support, like having someone
Mm,
holding your hand. You might get a family who is from another state and they're the only people there. They don't have their mother, their grandmother.
right,
They just need that nurturing feeling. And so we are there to support them, hug them, hold their hand through birth, and make sure that they are okay. So we're definitely in the hospital, but it's a point where we would need to be asked to be in that space,
right, right.
so long as we're invited into the space, we're there to support.
Oh, wow. That's wonderful. I did not, it didn't even thought, I didn't even dawn on me that they can be right inside the delivery room to the process, and the recovery as well. I mean, that's dope. I think that's very, that's especially like you just mentioned, somebody who might not have family and,
Hmm.
having a birth. I think having a doula there, it's a support that you need, right? Support that, make you feel like, okay, I have somebody with me, right?
Right,
I'm not alone in this journey.
right. you
Oh, I
know
like that.
Even if it's just to sit there and talk
Right.
to you, like,
Right.
I know people assume that doulas are just all natural birth, but we deal with
Mhm.
every birth possible. So whether you want to have a home birth, hospital birth, birthing center, whether you want a natural birth, epidural, whether you want to
Mhm.
bottle feed, breastfeed, it doesn't matter what you want to do. We are there to support you in your plan.
I like that. I like that. So, what is the difference? What would be the so? What exactly is a doula, and how does the role differ from a midwife?
Okay, so a midwife is more of a medical professional. They are actually more in alignment with a OBGYN. They are the ones who are going to deliver your baby, but throughout your pregnancy, they're going to make sure your blood pressure is good, make sure all the testing is done, and checking on your baby periodically
Mm,
throughout that pregnancy. As a doula, we're there to provide that emotional, physical, and educational support, and sometimes even spiritual support
mm,
where believe it or not, sometimes the midwife and the OBGYN, they only meet with you for 20 minutes per appointment. You're in and out. If you were anything like me, I had pregnancy brain and I would forget the questions that I had. Then you can go back and call your doula and then we'll recap. You can ask your doula any type of questions. We're providing you with a childbirth education, building your birth plan, and just really supplementing that time in between. So it's like we a lot of people assume that we're the same thing, but we're not. But we're on the same team, the
okay.
team of like supporting a family.
That's important. Yeah, yeah. I think I can see that. I can see how people assume they interchangeably be the same, but they are different, right? Not, I
Right.
mean, but you're right. They all are supportive to the family and especially the mom. So okay, all right. So my other question is, how does having a doula impact a woman's pregnancy, labor, and postpartum experience?
Woo. So it definitely impacts it. Um, First, the empowerment,
Yeah.
feeling empowered, knowing that you can have the birth that you want, knowing that
Mm,
you can do what you please and it be respected. A lot of times, again, you get into these spaces and your opinion's not respected, your body's not respected, and it shows in the mortality rate.
yes.
It definitely shows, the numbers are there. And so we're just making sure that you are protected the best way possible. So we're going in with a plan. We're making sure that everybody on the birth team is prepared for that plan, and also getting you mentally prepared that if that plan does not go as we planned, then sometimes we have to adjust, and that is okay. Um, We get a lot of moms who want to have a natural birth, and it's not easy, but we're still there for you if you choose to get an epidural. We're not judging you. We're there to hold your hand to make sure that everything is what it needs to be.
Mm. I mean, I hear you talking a lot. I hear a plan, right? I hear like the like plans just keep sticking out to me. That says that y'all in there creating these plans, making sure that the birth go well as possible, right? Not just the birth, but the pre-birth, right? How to
Hmm.
make sure that starts from there. Once you're pregnant, then you hire a doula or get and then you got come up with a plan, right? With a strategy. Do you help them with nutrition as well, like to maintain their weight as their stomach is growing?
Yes, we do. Again, that plan is really versatile. So we do
Mm,
talk about nutrition. And every doula has different certifications in different things. And so some
mhm.
doulas are certified in nutrition, some are certified as yoga practitioners, but it's
Okay.
all just a big wellness. I will say the biggest thing about doula is our network. We have a strong network, and so if you come to me to say, hey, I'm having trouble here with my nutrition, most likely in our network we have a nutritionist that we can refer you to. If you come saying I'm having issues with lactation, we have a lactation consultant we can refer you to. So we're not an expert at everything, but we do have a strong network where we can get you connected to get the support that you need. I think the biggest support needed is usually during postpartum.
Yeah.
We always plan
Mhm.
for birth. No one ever plans for postpartum. A lot of times you push out your baby and you now have your baby in your hands, and the mom's like, now what's next? So we don't
Right.
want that question of what's next. We want to prepare you before you get there so you know what's next and you have that support as needed.
Wow, that's when you I was just thought about that like postpartum. I mean, every aspect of pregnancy is important, but I feel like especially postpartum, right?
Hmm.
Because depending on your circumstances, some women can get depressed, right, after having a baby. One, because they don't know the process. It's a new baby. Like you don't know, you learning. You question yourself. Are you doing a good job, right?
Exactly.
Especially if it's your new baby. Especially if you're a new parent.
Hmm.
Um, I have to assume because I'm not a mom, but if I was a new mom, that would be my thing. Like, am I doing a good thing? What about if you have a baby that cries a lot,
I had a
right?
baby that cried a lot.
Right? What do you have a child that cries a lot? I'm sure the question like, why does the baby cry so much? Like, what am I
Hmm.
doing wrong? So I think that when you mentioned postpartum, do you help them and educate them on even depression? How does that look like as well?
Yes, I make sure I provide many resources about how you can deal with your perinatal mental health because it's
Hmm.
extremely important. Believe it or not, many women get it. Even the fathers get postpartum depression. I think it's one out
Really?
of 10
Wow.
dads can get postpartum depression as well. So it's really important to know that beforehand so you know what's about to hit
Mhm.
you, because it's not an easy process. We have our hormones that's fluctuating, we have a baby that we're trying to get used to, a routine
Mhm.
we're trying to get down packed. So it's a lot on you in one moment of your life. It's a beautiful thing, but it also can be pretty stressful. And so we definitely prepare you for the emotion side, but we also prepare you to deal with other things like, when you just had a baby, you don't want to be thinking about what you're going to eat for dinner every night.
Mm.
So we
Yeah,
talk
that's
before you have your baby, we talk about meal trains, we talk about prepping food, like who's going to do what. We build literally a plan. So who's going to do what, when you're in need, who's that one person that you can call? Is it your mom? Is it your friend? Is it your doula that you need to come sit with the
mm.
baby while you take a shower, because your baby won't stop crying unless they're held. So
Right.
we adjust to the needs of the mom and the parents and the families. Um, I think the most important is that first 6 weeks, because you're adjusting. But
Mhm.
at that time, after that 6 weeks, a lot of people drop off. They've helped you in that first few weeks, and then after that, you're like, where's everybody at? And so
Yeah.
you just want to make sure that you continue to support the
Mhm.
family, because postpartum can go up to a year, baby being in their toddler age.
Oh wow, I didn't know. I didn't know it was that. I mean, I didn't know it was that long. That postpartum,
Hmm.
could last. Oh, okay. I know you mentioned just now another thing that came to my mind as far as fatherhood, right?
Hmm.
How does a doula? Because I know that fathers too, they matter, right? So they go through their own journey on fatherhood, their own thought, their own experience, right? Trying to support the mom of their baby, and they, like you just mentioned, them too getting to know their baby.
Hmm.
So how does a doula be able to support the dad? Do you work with both families at the same time, or do you work with the mom but also guide the father to be a supporting to the mom?
Kind of like both. I asked
Okay.
the dad to come to all the appointments, and we chat about how he can be better support. It's nice to have a doula, but in birth you want the oxytocin to be going so the baby can come easier. And so we teach the dad on what to do to support you. So whether
Mhm.
that's hip squeezes, back rubs, hugs, whatever that looks like of nurturing and support, we guide the dads beforehand to do that. I personally think this is extremely important because dads get ignored all the
Yeah.
time. They
Yeah.
will be sitting in the corner of the hospital
Mhm.
room and the doctor will barely say anything to them. This is definitely more common with black fathers, and so
Wow.
it's really important that their voice is heard
Yeah.
also. They're a parent as well. They should be
Yeah.
respected as well. This is their baby as well, and so it's important to include them on these decisions, but also include them in this process, which will
Mhm.
make it easier for them to want to be involved and be there, because when you're being ignored and whether your doula or your midwife is acting like you're not there, you're going to be like, forget it. I don't even want to. What do I need to talk to them about?
Right.
Um, and they might have questions, they might have concerns, things that
Mhm.
come up for them just as well. And so we definitely make space for the fathers to be able to connect. In here in my area, Phoenix, Arizona, we have men doulas. There's a company, Doula
Really?
Bros. Yeah, and his name is Patrick. He
Okay.
does great work working with fathers, preparing fathers to support their women through pregnancy and making sure they have all the resources and men groups that they need as well.
Oh, that is great. I mean, especially like, you. I mean, you cover everything, right? Especially when it comes to father and fatherhood.
Hmm.
I mean, that's I didn't even know they had a man doula. That was a profession for men. So that's
Yes,
that's interesting.
it's not many, but the ones that are out there are definitely doing the work. They're
Yeah.
really just bringing the father to the forefront, letting
Yeah.
people know that they have feelings too. They care
True.
about their baby as well. They don't want to just be pushed to the back. And I know sometimes when you think about a black father, a lot of times they say that they're not in the home as often and things like that. But when you include them in these special moments and times, it makes it easier for them to be there. It makes
Yeah.
them want to be there because they have a better understanding of what you're going through. They have a better understanding of postpartum depression. They
Mhm.
understand that your hormones are fluctuating, and they also understand what needs to be done for their newborn.
Yeah, I think educating the dads, right? I feel like one, because that's what it sounds like to me. It's more like educating the dad on, the terms that the moms are going, things that moms are going to learn, right? Changing diapers, all these different aspects of journey of, parenthood. So I think that once the dads are taught or they've been, they teach them. I think that it would be a good. That's true. It would be a good journey for them. It would be a pleasant journey for them. They want to be present. They want to be there, because I mean that's important. So I think it is good that there is a man doula as profession for them too. I think that's nice. I do.
Yeah. And,
Okay.
it's not, again, it's not often that you find yourself having
Mm-hmm.
a doula. So even us female doulas, we will educate them, but it's also nice to have somebody that looks like them
Yeah.
teaching them and guiding them.
Yeah, that definitely, especially that part that definitely been through the experience or going through the, been there or is going through the experience. Especially have a new dad, right? What if it's a young new dad? That
Right.
alone, it's a lot of emotional that go, a lot of emotions that go through that they go through. So yeah, that's bad. That's a valid point. Okay, so how do you collaborate? How does the doula collaborate with other medical professions like OB? Do you after the appointment, do they notify you of any update, or how does that work?
So many doulas are independent, so they have to build those networks. And so the good thing about a lot of states now is that insurance is now starting to cover doulas. And so that means there's a database of
Mm-hmm.
doulas. So if a client comes in to their midwife and saying, "Hey, I need a doula," they're able to refer them to a doula for that support. And they'll just get that database and choose. But really just networking, really going out there, talking to OBs, talking to midwives, talking to families, ensuring that we're at different events. It's not easy because there's so many providers, but once you start, building those connections, it's definitely worth it. Um, we are a team, and so
Mm-hmm.
I know sometimes there is a negative thought about doulas coming into a space and then trying to take over the space, and that's not what we do. We're
Mm-hmm.
there to respect the space, we're there to respect the practice, and we work alongside any practitioners. And so we are part of their team. They are the medical professionals, and so we definitely respect what they're saying, but we also make sure that we're protecting the family as well. And so if there's a question, we make sure that the family feels comfortable enough to ask it. Sometimes we go into a doctor's office and we believe everything that they say because there are doctors and we don't
Right.
question them. But
Right.
sometimes it doesn't fit everybody, so you just need to ensure that you feel comfortable, your questions are being answered, and if something is off, we can address it in a respectful way.
Yeah. Yeah, I think that's key, just having that support system. And everybody doesn't have so depending culturally, right? I always think about that culturally too, asking questions, looking in the eye, things like that.
Hmm.
Some people don't do it not because they're disrespectful, but it's a cultural thing too.
Right.
So I think that having a doula who can talk for you, right, who can advocate for you, who can, ask you as a patient, hey, as a client, do you have a question? Is something you want to ask? And just having that comfort there, I think
Hmm.
that's very essential too.
Right. And having somebody to boost your confidence,
Yes, yes,
like
yes,
you
yes.
can do it. We're here
Mhm.
for you,
Yeah, definitely.
we if it wasn't for the families, we wouldn't
Mhm.
have these careers, so we're here to protect you and to make sure you are okay. And so definitely just building their confidence to let them know that they can make these decisions um,
Mhm.
with or without a doula.
Yeah, definitely. Yeah. So I know when we first started, the intro was like tomorrow is Black Women's Health Week. And I just want to recap for people who might know or might not know what is the definition or what is the reason behind Black Women Health Week, right? It runs from tomorrow up to April 17th. Yeah, April 17th. And the reason is to aim to raise awareness of maternal health in inequities and empower Black mothers and families. It's focused on community building and advocacy for improved outcome. And the reason why this initiative started, for those who might or might, because I don't know if people know, right, is because as you may know, that maternal health in the United States is at its crisis, right? Women, especially Black women, are dying at higher numbers compared to their counterparts, meaning white women. So this is one of the reasons why I wanted to start this conversation today, just to highlight a supporting factor towards it's a disparity, right? A doula help shows a disparity of maternal
Right.
health, right? in many ways. Do you want to share maybe how does a doula help improve maternal health?
Yeah, so Black Maternal Health Week is extremely important.
Yeah.
There's tons of events going on, so much
Yeah.
awareness out there. So definitely
Mm-hmm.
look what's going on in your community. But in reality, we are dying at a higher rate than any other race.
Mm-hmm.
Here in Arizona, it's white 13 white women per 100,000 compared to 79 BIPOC, Black Indigenous people dying at 100,000, so
Wow.
13 to 79 every 100,000 births. And
That's a high
that is a
number.
huge
Yeah.
gap,
That's a high number.
that there is obviously something wrong
Yeah.
and something that needs to be corrected in our system. And so
Mm-hmm.
we as doulas, this is why we advocate, because a
Mm-hmm.
Black woman will go into a hospital and say she's in pain and not be
Mm-hmm.
taken seriously. They might not, they think that Black women have a higher pain rate than any other race. And in reality, we are just as human and we should be respected. Our body should be respected, but also our voice should be respected. And
Yes.
so it's important to just get that information out there, even if you might not have been affected, but maybe a friend, a family member have been affected
Mm-hmm.
of going into these spaces and not almost losing their life during childbirth, because it happens very often. So
Yeah.
yeah, Black Maternal Health Week is extremely important, and we all should be bringing awareness to just maternal health, but definitely Black maternal health.
Yeah, definitely. It makes it think me. What I was thinking about was how Serena Williams has stated, even her, right, her being who
Mhm.
she is, struggle, right, had an issue where doctors didn't believe that she was in pain,
Preeclampsia. Hmm.
right? So, and this is one of the, preeclampsia is one of the things that a lot of women die from, right?
Yes. Yep.
So I think that this is why this conversation is very, 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 very essential to have. And I'm glad I decided to start this today. The first, and it's the first day to the opening of Black Maternal Health Week. And I'll be posting more about it, because just for education purposes, when it comes to Black women and maternity, right? It's a beautiful journey, and nobody should have to die because they're not feeling heard. So, okay, so now that we know all this about doulas, why do you think more people are not don't have doulas?
Well, I believe doulas is kind of, people are finding out more about doulas. They don't know that
Mm,
support is there, and so this is something that they're finding out. But also, there is a cost to doulas, and a lot of medical providers were not supporting just that cost of getting you a doula. And so now we see that it's more common that different states are allowing their different Medi-Cal and private insurance to support you in getting a doula. And so I think
mhm,
as that rolls out more, which I know in the next maybe 5 years, most states will be accepting doulas. Um, California is at the forefront of this. They have been covering doulas for a
mhm,
long time, and they cover doulas well throughout your birth and tons of throughout your postpartum. Like they're
mhm,
really great at that. Here in Arizona, our Medi-Cal just now started covering doulas October of 2024, and so it's coming. It's just it is a cost, so it's not a free service. It is kind of like your practitioner. If you go to a doctor, if your insurance doesn't cover it, then you will
yeah,
have to pay out of pocket. But I think once people know the benefit of having that advocacy and that
mhm,
support, then they'll definitely jump on the bandwagon of having a doula. I think a lot of times, even as a gift, we think about what are we gonna give our family members.
wow, that's
We're gonna
mhm,
give them all these clothes or this or that, but maybe even supporting with a doula, supporting
mhm,
to have the type of birth that they want to have, because I think we get so caught up in the material things that we don't really
mhm,
focus on our mental health and our
mhm,
physical health And then once that time hits, we're like, oh man, I should have done this, and
Mm-hmm.
that support is there for families. They just have to, connect with the doula. And it's widespread now. So I'm sure that you can find a doula in your city, town, state. There's so many directories, and there's even traveling doulas. So like you can find a doula that's gonna support your specific need. And so like again, if you are looking for a fertility doula, there's somebody there for you. If you're looking for a postpartum doula because you need support with overnights with your baby, there is somebody there for you. I do just recommend, interviewing different doulas, making sure that that connection is there because this is an intimate moment.
Mm-hmm.
Um, this is an intimate moment for you, and you're inviting us into your space. And so you want to ensure that you're comfortable with that doula and you trust that doula. And I believe that it can make a world of a difference for you.
Oh yeah, definitely. I know here in New York, doula they have um Medicaid do offer doula programs. And a few other states like I believe New Jersey. The
Mhm.
higher states, New Jersey, Washington, those type of states. But I
Mhm.
think private insurance is a little different. I feel like eventually they're going to catch up, and I agree
Oh,
with you.
yeah, they definitely will. Doulas are being covered in Florida, Georgia,
Hmm.
Arizona, Houston, like Texas. That like so it's coming. So if it's not in your state now, it definitely will be soon.
Yeah, definitely, definitely. So, what advice do you have for women considering a doula, but unsure if it's the right one for them? Right?
Right.
What should
Interview.
it look? I'm sorry, cuz. What should someone look when choosing a doula? That would be so. It's a two-part question.
Okay. So definitely interviews, right? Like how you like it's a job at the end of the day. So you
Mm-hmm.
to interview them again, make sure that you have a connection with them. Make sure that it feels right, but also
Mm-hmm.
ask them what is your expertise. So hey, if
Mm-hmm.
give them scenarios. If I was in this position, what would you do? How would you
Mm-hmm.
react to it? Ask them, hey, do they have any children themselves? What are their beliefs? You might have a doula that it has a strong belief in this certain area and it just might
Mm-hmm.
not fit well with you, you know.
Right.
So you just want to be sure that you ask as many questions as you can. Definitely look for recommendations and Google Google them. See what comes up. See if they have any reviews. Reviews don't lie. People are telling their experience. So definitely see what other people are saying about them. If they come by recommendation, that's always great because you had a friend or a family member who had a great experience with that doula. So that's always great. But if you are the first in your community to get a doula, definitely ask questions. Some doulas are more advanced than other doulas. Some doulas are experts in certain subjects, and so if natural birth is what you want, find a doula that is for natural birth, holistic birth. If you are a naturopathic person and you like natural things and you don't want too many interventions, there are doulas for that. So you just figure out what that looks like for you, and then you will find a doula that is in alignment with that.
Okay, that's good. I mean, that's great to know, though. I didn't know they had so many different kinds of doulas. So, it's good tips. It's good tips for people to start, deciding if this is something that they want, how they should start looking for a doula. Questions that they should ask, right? And I think you brought it home when you said values that have to align, right? That do have to align,
Very
definitely.
much. Yes, because you don't want a doula that is, I'll just throw this out there. Like I don't believe in abortions at all, and maybe you've had to have one previously, and you don't want to
Mhm.
be judged. So you just want to find somebody that you feel comfortable with, who has the same moral standards as you, in alignment with you. And there are so many doulas out there that I know you can find one and have that support. And then I say check back with your insurance. Call your insurance company and
Yeah.
ask them, hey, Are you accepting doulas? When will you be accepting doulas? If I pay for it out of pocket, do I get a reimbursement?
Yeah,
You
that
know,
too.
yeah, definitely come
Yeah,
with those questions and ask your insurance company if it's something that they're willing to cover for you, because it's definitely a need for you.
yeah.
And yeah, get that support. It's out there.
Yeah, because maybe they won't cover partially, fully, but maybe they cover partially, right? So that's
Exactly.
something. Some Yeah, that's a good tip. Definitely call the insurance and find out if they do pay for doulas, or maybe not the doula services, but what would they pay? Would they pay for lactation, consultation? Would they pay for this? Would they pay for that? So that way you have, you're just gonna have to figure out how much you're gonna have to invest when it comes to the services. You know,
Right.
yeah, thank you first of all, thank you so much for today again. It was a great conversation. I enjoyed myself and I hope everybody else did too. So, how can they find you? If they want to connect with you, if they have a question for you or they're looking for your services, how can people find you?
So you can go to my website, which is spiritualgardenhealing.com, or you can email us, which is spiritualgardenhealing@gmail.com. On all platforms, we're Spiritual Garden Healing. And so even if you just slide in my DM, I definitely make time for
Mhm.
supporting. You don't even have to hire me. If you have a question and you just need to ask some questions, I am there for you. Again, I am an advocate for maternal health. And if you need that support, even if you're in a different state, I'm able to find that support in your area to make sure that you are protected and empowered during your birth. But
Yeah.
please contact me. I have a Google form on my website, and it'll ask you just a variety of questions of what are you looking for? Are you having housing issues? Are you looking for a postpartum or a birth doula? Do you need baby items? And so it's a wide
Mhm.
variety of just questions that's going to help us better help you.
Wow, that's good to know. I mean, that's good to know, especially, we don't know what people's going through. So
Mhm.
also, I also wanted to add her LinkedIn. If anybody want to connect to her here on LinkedIn, definitely go to her LinkedIn. Just look up her K Clinton on, the search box, and follow her, guys. Connect with her if you have any questions at all in referencing to doula. As she just mentioned, she's a full spectrum doula, so she's able to answer an array of questions. Okay, so thanks again for today. Okay, I appreciate you so much. But everybody else, have a good evening.
Bye
Bye,
bye.
guys.